if you've made the diagnosis that there is osteoarthritis, we can't cure that. There's no injection out there, however much you pay for it, that's going to cure it. But you can manage symptoms, can't you?
That's
And
right.
you can also, particularly if you think you're going to go and have an operation at some point, you can try and maximize your range of movement, try and get some strength, and try and go into that operation as strong as possible. Certainly here, from a physio perspective, we find that steroid injections, obviously overuse of steroid injections is not a
It's
good
bad.
thing,
Yes, yes.
but it can give you a window of opportunity to try and get in the gym and do some strengthening exercises, try and get slightly better range of movement. And there's no doubt, and I say this to my patients, is that the hyaluronic acid, the viscosupplementation, the steroid, the combination, if you've got a severe arthritic joint, very unlikely we're going to be making much progress. But there's definitely a group of patients, mild to moderate sort of changes. And, it is generally people that aren't overweight. That is something that we know there's very good evidence to support, that if people are a bit overweight, it puts a lot of pressure on their knee pain, a lot of pressure on their knee. But I do find there's a group that are quite active, not overweight, that are able to exercise still, that do quite well with injections and physiotherapy. And when I say physiotherapy, there's so many different types of physiotherapy. There's so many different exercises out there. One exercise program doesn't fit all. And I think it's very important that if you see a physio, that they are tailoring it specifically to your knee joint problem, be it range of movement or strength.
I fully agree. I think we also recognize that this is not just a physical journey, but it's a mental journey. And as people live with their joint that is wearing out and misbehaving at different intervals,
Yeah.
I think the injections and the injectables form a nice adjunct to the things we can try.
Yeah.
But eventually the patient gets fed up, and they will know. Very often I say to the patient, you will know when the time is right,
Yeah.
where you want a more permanent solution. And then we move on to, okay, well, what is that going to be?
So one of my questions later on is, when is the time right? Because that's such an important question, because I see patients that are 80 years old, they've got a really grotty knee. We're trying to manage it with injections, and we're doing okay with 2 or 3 injections a year, but they're having a diminishing effect, and they just won't have an operation done. And then you get the ones that, well, I can't run anymore, your 60-year-olds, and they're like, well, maybe I should have a knee replacement. And obviously those are two extremes, but when do you think the timing's right?
Well, I think there are certain things that I look for. So firstly, it's good to do it when the patient is fit enough to, for it not to be a too risky an operation. These days we've simplified this operation to make it quite straightforward. It really takes about half an hour or not much more than that. And so, but doing it when the patient doesn't have comorbidities is an advantage.
So that's when somebody, just explain what you mean there,
So
Sam, about comorbidity.
what I mean is, if somebody gets frail and they've got lots of other medical issues concurrently, suddenly what is essentially a fairly straightforward elective operation then takes on new risks. So hanging on for the sake of hanging on is not a sensible thing.